on this episode of Insight. It's our country's #1 killer. Are we equipped to manage dementia? Nia, dementia runs in your family. How has that affected you?
Quite profoundly, I'd have to say. My grandmother, Evie, was 80 when she was diagnosed, and she died at 102. And then my mother, her daughter, Moira, she was diagnosed or started to show signs of cognitive decline around 58, 59 years old. And she's now 76, and not having my mum around is probably the biggest thing. But it's petrifying knowing that, I could be third in line.
You did genetic tests to see if you might also develop dementia. What did you discover?
I chose to go down that road, and I discovered that I had the APOE4 gene. It did take a little while to process, but it doesn't guarantee that I'm going to get the disease. It just increases my risk, I believe. So people that don't have the 4 can get dementia also, Alzheimer's. So it's very much about how I live my life and just making the most of the time that I have with a healthy brain.
Jessica, your mum, grandmother and 2 uncles also had younger onset dementia. Can you relate to Nia's fears?
I can, unfortunately. I also got tested. We kind of got contacted by the Royal Melbourne Hospital in 2018. Mum obviously was sort of sparked in the system somehow because she had 4 forms of dementia. And so they asked me while we were there if I'd be interested in getting tested. And I did, and I chose the route of not finding out because it is really scary. Back then I think I was 25 or 26, which is so young to find out what's inevitably going to happen to you. And so I thought, I don't want to know because I'm going to live my life anyway, however I live it. But I so respect your choice to find out because it is interesting to think about how I might have made those changes. But at 26, I thought, no way, Jose.
Jonathan, you were working as an engineer when you started struggling with some routine tasks. What happened?
I found over time that I just found all sorts of tasks more difficult. It's like looking at a jigsaw, but the pieces that you've been given are from half a dozen different jigsaws. So it doesn't matter how many times you try and put them together, it just doesn't work. But you know that it should.
Did you have other symptoms as well?
I'd lost a lot of the emotional intelligence I'd had previously. I found just, having dinner with the family challenging. So at any time during dinner, we would have dinner together most nights. There'd be at least 3 conversations going at the one time. And I didn't realise before I learnt more about dementia, but one of the real points for me is that I can only follow one topic at a time. If I try and follow a second topic, I can't follow either. So what I was finding was that at dinner, I'd just get very frustrated in a short period of time and ultimately, remove myself from that situation. But family dinner was my favourite time of the day. So I was upset that I wasn't enjoying that anymore.
When did you start to suspect it was dementia?
I had a very strange experience in that I went down to Melbourne to help look after somebody I was quite close to who has dementia. And I'd sat with him for about 10 minutes and I'd recognised these issues that I'd had over quite a period of time. And it just struck me that I thought, wow, I think I have dementia.
Henry, you were named Senior Australian of the Year for your research on dementia. Your dad also had dementia. What exactly is it?
It's 2 things. It's cognitive decline, interfering with day-to-day function. So if you are declining cognitively and starting to interfere with how you're managing your life day to day, that's dementia. But dementia is an umbrella term. It's not a diagnosis in itself, because underneath that, there are many different causes.
So what are the types of dementia we're talking about?
The most common is Alzheimer's disease. It accounts for at least half the cases, maybe up to 60% or 70%. The second most common is vascular dementia. That's problems with circulation in the brain. It may be narrowing of the arteries, or it may be strokes, small strokes or large strokes, or even a hemorrhage. The third one is Lewy body dementia. And that's rather unusual. People have REM sleep disorder. They move around in their sleep. They can hit their partner and be completely asleep. They often get visual hallucinations and paranoid delusions, have falls, and have some Parkinson-like symptoms. And the fourth major type is frontotemporal dementia. That can have two forms. It can be a language form where people have difficulty putting words together, or it can be a behavioural form where people become disinhibited and not the self that they were before.
A common belief that it only affects the elderly. Is that true?
It mainly affects the elderly, but there's about 30,000 people in Australia with dementia started before the age of 65. My father started at 52, and there are about 2,000 children who have dementia. That's a different ballgame in a way, because they're genetic aberrations that lead to that generally.
Dementia is Australia's #1 killer. Why?
People die with dementia rather than from dementia. And so the way death certificates are recorded, they write down all the diagnoses, and dementia predisposes to some other reasons for death, usually like sepsis, infections like pneumonia, pressure sores, which can spread the infection from there as well, malnutrition, immobility, and frailty. So these things combine and people become more susceptible.
Shirley, how are you going today? Hi, nice to meet you.
Hi.
How are you feeling?
Good.
And you're here with your daughter?
Yes.
Jasmine, you currently live with and care for your mum, Shirley. Before that, you were living and working overseas. What did it mean for you to move back to Australia to care for her?
I had to change my life pretty much overnight. It's a bit emotional, but at that time, you know, when you feel like you're a Mulan, you've just got to go and do it and save the world, you know, and this time it's my mum. Mum already said to us that she didn't want to go to a home and she wants to stay at home, right, Ma? So that was an obvious decision.
How have you found being a carer for your mum?
It's not easy, but I think you need to sort of kind of embrace whatever that comes at you, like a video game. So you've got the controllers in front of you. It's either whether you go left or right. And I met a genius of a woman in Singapore once. She said, whichever decision you make is the right decision until it's not.
What's it like seeing your mum change?
Have you changed, Ma? She still tells me off. So at 4 a.m. in the morning, she would be like most alert because she used to wake up. She was a Woolies checkout girl, and when she came to Australia, in Malaysia, she was a school teacher. So we would have conversations at 4 a.m. I found ways to kind of like cope with it. When she's lucid, I'll record it, so, you know, and play it back.
Luke, you were with your partner Lisa when she was diagnosed with Alzheimer's at the age of 47. Some of her symptoms surprised you. What were they?
With Lisa, it was more around the personality and behavioural changes, in particular apathy and a disinterest in daily activities and a real change in the type of person that she was.
So how did that sort of play out in day-to-day life, that apathy?
Yeah, well, Lisa was a very fun and energetic person who loved socialising and doing things and a wonderful, caring mother. But as the dementia progressed, there was a distinct change. She would come home from work and just want to sit on the couch and didn't want to engage with the children, didn't want to go out to see friends, really didn't want to leave the home at all. And her sort of day-to-day life changed significantly in that front. She was, in bed early and, just a lot of disengagement from, who she was and what she liked to do.
What did you think was happening at that time?
I certainly didn't think it was dementia. I thought that she might have been stressed or anxiety or more likely probably depression.
When did you realise you needed more support?
Yeah, it wasn't long after the diagnosis that I really started to see the dementia in Lisa and be able to separate it from who she actually was. And when I saw that sort of grow and impact even more elements of her life, I realised that this was not a one-person job. We had 3 young children in the house at that same time, and she was diagnosed in early 2020, so a couple of months later we went into COVID lockdown. It was intense. The repetition, the unrelenting nature of that, the confusion, the agitation, the fixation on certain elements of the house or things that people were doing in the house. It might be, say, the washing machine. So as soon as somebody had something to go in the washing machine, she had to put it on. She had to get that washing done, had to dry it and so forth. Or somebody would put something into the bin and she would be obsessed with taking that bin out. So, it became very difficult to manage just living in that environment with children who didn't understand the disease at all or didn't understand the behaviours that Lisa was displaying.
Did you feel like you could keep her physically safe?
Not for very long. She became obsessed or fixated on certain things. So one example is having the basic supplies in the house. So whether it was cheese or bread or Vegemite, which she loved, she would run off to the shops to get more of these things, despite me saying, laying out the 6 or 7 packets of cheese that we already had. She would not remember that, not recall it, and head out of the house and go down to the shops. But at that time, she wasn't obeying road rules, safety. She wasn't safely crossing the roads or getting herself to the shops, and she was going multiple times a day and heading off. And I couldn't stop her. I couldn't physically restrain her. She was able to, bypass things like locks on gates, and it became very unsafe as an environment for her and also very unsafe for the children.
You sought help from Dementia Support Australia. What did they advise you do?
They told me that if I couldn't handle it, if I couldn't cope, if I couldn't keep Lisa safe, then I should take her to the hospital.
Lisa stayed in hospital for 3 months. Why?
There was nowhere else for her to go. It was a terrible experience. Her health deteriorated significantly. She was very difficult to manage in the hospital environment. I was fortunate enough that I could get some level of support and support workers to sit with Lisa and help her in the hospital environment, but it was a very tough place for her to be long term.
You were trying to get the NDIS, the National Disability Insurance Scheme, to look at your case for support. How did that go?
It took a long time. Initially, all of the requests for additional support, whether that be accommodation or support carers to be with Lisa, those things were declined. There wasn't an understanding of the disease and how it impacts people in that age group in that way. But the team at the hospital really wouldn't let her be discharged back into the home environment. Their recommendation was that she needed to stay and that we needed to go through that process and force the system to find something for her that was more appropriate.
So if she went home, it would be seen as her not needing support.
Yeah, that's right.
And you wouldn't be able to then access the funding.
Yep.
Let's break down the numbers around dementia in Australia.
In Australia, there are more than 440,000 people currently living with dementia, and 1.7 million people involved in their care. Government subsidised supports are available through Medicare, aged care, and for those with younger onset dementia, the NDIS. But these services are already stretched, with limits and delays to support leaving many to fund their own care. In 2016, the cost of dementia to Australia was $14.25 billion. That's an average of more than $35,000 per person with dementia. In 2022 to 2023, the Australian government spent an estimated $4.7 billion on aged care, healthcare, and support programs for people with dementia. There are indirect costs as well. For example, when a person or their carer might have to leave the workforce or sell assets in order to afford care. These costs are expected to grow, as the prevalence of dementia is projected to increase by 82% over the next 20 years.
David, you were the chief economist at the NDIS. Why is it only available for dementia patients under 65?
Because for some reason, people decided that you don't get a disability after age 65. If you're after age 65, you go into the aged care system, which is essentially about maintaining you. If you're under 65 now, you go into the NDIS, which is about trying to maximise your outcomes, trying to give you a life in social and community participation. Age pension eligibility is 67. Superannuation, you get eligible for at 60. 65 has no meaning. It's clearly a piece of age discrimination, but except it isn't, because the Age Discrimination Act has been amended to say the things the NDIS does are not age discrimination by law.
Jonathan, you receive NDIS support for younger onset dementia. How do you feel about the care that you get?
The care that I receive is very good, but I'm not comfortable receiving support from elsewhere. I've always believed that we really should be self-sufficient where we can, and I've spent my life trying to be self-sufficient, and our family has been self-sufficient. So I find that challenging, but at the same time, I realise the effect that my dementia has on my family and on the people around me, and the support of NDIS assists with reducing the load on them, which is a good thing.
Sophie, you're Jonathan's wife. What was the process like to get help?
Big, really big. I knew someone who worked in the NDIS space, and she said to me, "When you're ready, come and talk to me." And we did, and they have literally held our hand all the way. And it's gut-wrenching, the process. For anyone in this room that's been through it, it's absolutely gut-wrenching.
In what way?
You have to really be vulnerable. And, you know, we're both positive people. We get on with life. We've dealt with premature babies and heart surgery and burns and fathers dying of cancer. We've been through a lot, the two of us. But this was on another level, where you literally have to expose yourself in the deepest way to the system to be able to be identified as participants that are needy of NDIS. And that is not something that Jonathan ever would do. But in order for the system to understand our situation, because when you look at him, he's as far as I'm concerned, a handsome, you know, a handsome, intelligent man who can still talk and still walk, yet our needs are huge and the needs for our family are huge.
Luke, Lisa is also on the NDIS and she's eligible to stay on it for the rest of her life. What does that mean to your family?
Without the NDIS, our family would have been completely disrupted. We would have lost our home. Financially, the impact is, as we've said, it's huge, and not something that we could cover in any way on our own or on my own, being the only person capable of working in the family. It would be beyond us to even stay where we were, and we wouldn't be able to find the right care for Lisa. She wouldn't be where she is without it.
Where is Lisa now?
Yeah, Lisa resides in a specialised disability accommodation. That has helped enormously having her there.
Do you mind me asking how she is sort of physically?
Sadly, Lisa is non-verbal and immobile.
What's the financial value of that around-the-clock care?
Lisa's NDIS plan is about $1.3 million a year.
David, are we equipped to manage dementia through the NDIS?
I think the NDIS is the best place for people, younger people with dementia who are still functioning, because the NDIS's main difference from the aged care system is that it seeks to enhance social participation, enhance economic participation. It's not just about maintaining someone. It's definitely the best place for such people. But let's just look at some figures, okay? Because equipped to me means can we afford it? A person with a level of dementia, which we've just described, if they were 70 or 80 in aged care home, would be receiving $120,000 in funding. There are 100,000 of those people with dementia in residential aged care. I'm sure that they wouldn't all need 1.3 million, but if they did, that's $1 trillion, which we don't have. Okay, so I myself have struggled for a long time about the concept of value for money. There are many things as health economists that we worry about. There are many drugs which save lives, but on the PBS we don't list them because they cost too much. And we say, we're sorry, we know this drug will save your life, but we can't afford to spend this money on you. There are better things for us to spend the money on. I mean, my father had dementia, my grandfather had dementia. I'm not a callous person, I hope. I feel for this person, but I have to ask myself, how many people can we afford to spend $1.3 million on when there are so many other unmet needs in the country? And that's the question which we haven't yet asked in the NDIS, because the NDIS, unlike every other part of the health system, the aged care system, the NDIS doesn't actually worry about value for money. It worries about maximising outcomes for the individual, which sounds like a wonderful thing, but when you're spending $49 billion, heading towards $100 billion, you have to start to wonder, are you getting value for money?
We've heard that the number of people living with dementia will increase by 82% over the next 20 years.
Yeah.
How are we going to fund that?
Well, not how we are currently funding it. When I was a young man, many years ago, there were 100 people of working age for every person in aged care. Today, there are 28 people of working age. By the time the younger generation turns aged care in 2060, there'll be 15 working people for every person in aged care. There just are not enough people to pay for aged care anymore. The problem in the current system is that the younger generation pays for the aged care for the older generation. We need to move to a system where generations pay for their own aged care. And the Royal Commission tried to make some recommendations about that, but so far they've fallen on deaf ears.
Luke, after your partner Lisa was diagnosed with Alzheimer's at 47, your relationship changed. How?
It changed significantly. I saw myself as Lisa's care partner rather than a traditional partner. And that helped me step into the role that she needed me to play, and also helped me come to terms with the diagnosis, and my relationship with Lisa was better for it.
Lisa spent 3 months in hospital, then went into an aged care facility. What was that like?
It was terrible. I am thankful to the people who ran that aged care home, who took Lisa after I had to really beg and plead for her to be in that environment. But it was not appropriate for her at all. Her needs were not being met. And so she would be left on her own for a significant amount of time. She was confused, and she'd become agitated and aggressive, and left in a single room with a shared bathroom with somebody else, an older person with dementia. It was very unhygienic and unsafe for her.
You managed to move her into more specialised disability accommodation. How did you do that?
A lot of begging and pleading and waiting and following up and making phone calls. So it was a lot of work to get her into that. And when she did get into that sort of normal home environment where she was able to live in an apartment by herself with the carers, she started to do better in that environment. It was much easier for the children to visit, and those visits felt much more normal than they had in the aged care environment.
Jacob, you're a journalist. You've reported on the aged care sector for the past decade. Have you heard stories like Luke and Lisa's?
Absolutely. Aged care is basically housing people at this point, and it may accommodate them being alive, but it's not accommodating happiness. And people who are younger going into aged care, it's particularly problematic. I remember when the Royal Commission was going on, they actually had a town hall thing in Bendigo, and I remember going there and listening to people, and probably the most devastating thing I ever heard in my life, a woman came up to the microphone, because it was members of the public speaking, and she said, I was in a car accident. She was about 40 or 50 years old, and I can't move my legs and I can't move my arms. And she was sort of reading this note, and she said, I've lost my ability to think in here. I stare at the walls all day. I can't even daydream anymore. And my only hope in life is to rehabilitate myself enough to get my arms to work, to hug my kids and kill myself.
You have personal experience with this. Your mum has dementia. Yep. Given your knowledge of the sector, was putting her into aged care an option for you?
I didn't want to do it. I felt guilty as hell, but it came to a point where there was no other options left for me. I live about an hour and a half away from mum, so when things first started occurring, I would travel there, and at the time, my wife, she was just fallen pregnant, and we had just bought a house. So I've got a pregnant wife who was giving birth, and always driving to Mum's place, and I was sleeping over there during the week, and I had my brother there as well, and my uncle helping out, and seeing all this sort of stuff unfold, it was just like I was trying to do absolutely everything possible. We all were, my whole family was, to keep Mum at home because we know that's where she wanted to be. But yeah, one night she actually sort of got out of bed and she went downstairs, and she went into the laundry and she accidentally drank bleach. Not a whole lot of it, wasn't very, and that was just sort of like the alarm bells were ringing. But then it's just guilt. And I think a lot of carers, people in here who are caring for someone with dementia will probably identify with that. Your whole life is just racked with guilt. Because if I'm leaving my house to go and see Mum, I'm leaving my pregnant wife or my young baby behind to look after Mum. And then when I leave Mum, I'm going back home and I feel guilty about leaving her there. And yeah, taking her to aged care was one of the hardest decisions of my life.
What do your mum's days look like now?
Well, Mum is non-verbal and her mobility's gone. So she essentially sits in a princess chair, they call it, all day. And initially she was just sitting in her room in bed most of the time. And they're like, oh, well, we take her out, once or twice a week. And I'm like, she's not a friggin' plant. Like she needs to get out more than that. And they're like, oh, okay, we can do that more often. I'm like, thank you. That's good. Place her somewhere where there's people around.
Sherry, you've been a general nurse and you have also specialised in dementia. What skills are unique to dementia care?
With dementia, you need to have a very deep understanding of what is happening with these brain changes. And more so, I think, we need to understand how, as a carer, we need to adapt and change our approach because we're the ones that have to do the changing. The person who is experiencing the dementia can't change the things. So it's up to us to have to do that for them.
You also train other nurses in dementia care. Sure. What have you found?
The basic online training that's given across the board is very generic, theory-based, symptomatic-based, but not practical strategies. They're not given the tools of how to help somebody. They might know what Alzheimer's is, but they don't know how to help somebody when they're distressed. They're just not able or well enough equipped to be able to do it.
Are there enough trained nurses at the moment?
Across the board, no. Enough trained people with dementia skills? Absolutely not.
An NDIS or nursing home carer, what kind of training do they need?
As a basic carer, they would have a 12-week course that they do, training in what we call activities of daily living, which is showering, dressing, helping them hygienic-wise, helping with their meal assistance, that sort of thing. Very small amount of dementia, just basic dementia theory, but that's where the big gap is. So then they're sent into these environments where they just don't understand really what to do. Their intention is amazing. They're very caring people, but they just don't know what to do properly.
Henry, you've been researching dementia for 4 decades. Should there be compulsory training?
Certainly everyone in aged care should be trained, but hospitals particularly, because probably half the people coming into hospital are older. They're much more likely to have multiple morbidities, different diseases. People with dementia stay longer, they have more complications, they have a higher death rate, they cost more to look after, and staff often don't understand it. I think nursing home staff are more likely to understand how to look after people with dementia than people in hospital.
There's currently no cure, but is there anything we can do to prevent dementia?
That's my hobby horse. There's so much we can do. We know that about 45% of the risk of dementia are modifiable factors that we could do something about. 55% is not, and so I don't want people who have dementia to feel guilty that they got dementia. But if we look after our health, if we're physically active, we get a good education or keep our brains active in life, keep socially connected, look after our blood pressure. I can go through the whole 14 factors if you want me to, but there is much we can do. We've been really good in Australia at prevention. Skin cancer, slip, slop, slap. HIV, we did a terrific job there. Smoking reduction. We need a brain healthy promotion program. And as Senior Australian of the Year, that's my big mission for 2026, is to try and achieve that.
In terms of those things that we can do, can doing these things after diagnosis also have an effect?
They can, and dementia is a terrible diagnosis, but people can live a very positive life for many years after they get a diagnosis. So there's cognitive stimulation, there's cognitive rehabilitation. There are a lot of programs out there which are happening. Dementia Australia provides huge support for people with dementia and for their families.
Gwenda, you have dementia and were given 5 years to live. That was 14 years ago. How have you managed to beat the odds?
Initially I gave up and I just went to bed to die, and I wouldn't die. And it was actually a phone call to Dementia Australia that actually did change my life. And I had a lot of support from a community engagement worker, but I haven't had a lot of support since, really. I burnt my family out. Care fatigue is real. I know my dementia has progressed. I'm aware of it. I love listening to Luke. The washing, you have one thing in the washing machine, you've got to turn it on. I don't know why people think that's not normal. I don't know why they think it's not normal to have 25 packets of salada or have to buy more digestives because they might run out. You mightn't get them. It's part of my life now, and I've forgotten what the question was.
That's absolutely fine, Gwenda. Have you been doing anything to sort of help your brain, I guess, in the time that you've been diagnosed?
I think I've been very blessed and very supported by Allied Health. That's what's kept me going.
You were adamant you would never go into aged care. Why?
I was never going into aged care because I was never going to be one of those people sitting in a princess chair. I was never going to aged care, never. I was going to get voluntary assisted dying. I couldn't get voluntary assisted dying, and I didn't want to be somebody who was dumped in a nursing home.
Where are you living now?
I'm living in Newcastle in a place called Moreover, but living in a house with 7, and there's a whole community. It's a micro town. Also, I'm a concessional. I'm on a full pension. You've got to have money to go into residential care. You can't go into a group home or small if you haven't got money. So I had to make a decision. I was going to choose for me, but I had to choose what I could get as a concessional client.
Do you like where you are now?
I absolutely love it. I have never been happier at any stage in my life, even with children. I am so happy. I love the people. Do I experience dementiaism, which is my word? A lot of people with cognitive decline dislike immensely people living with dementia, and dementiaism is real, and I really want to say that. But I love being with other people living with dementia.
Jonathan, you don't want to go into aged care. Would anything change your mind?
Not that I can really think of. My life is based around my family and around friends and so on as well. But I really want to stay at home. It's where I'm most comfortable. It's where the people I love are. And I don't really see a point for myself in going and living somewhere else if I'm so unwell or I've progressed so badly, if you like, to need that.
Sophie, you and Jonathan are currently renovating your home. Why?
It needed it. We have lived in our home for nearly 20 years, and one of the things that became really obvious over time was that a lot of the general maintenance that would occur in a family wasn't happening. But my goal is to have Jonathan at home for as long as we can.
So what are some of those renovations that enable that to happen?
Some of the examples are having colour differentiation. So you need to have a 30% change in colour between surfaces. So having handles on kitchen doors rather than having the push press ones. Because if he went to a door without a handle, it's where do I press? That corner, like how do I open it? That's confusing for him. So I've instructed the builders, we wanted handles that were solid enough for his man hand to grab. We've widened doorways, so should Jonathan need personal care in the future, we'll have wider doorways for him and potentially the carer or myself or the girls. I've even put in fluted shower screens, so for a bit of privacy for Jonathan. So if he does have to have a shower with a carer, then at least when he's in the shower, he can have a little bit of privacy. And he doesn't clean up after himself at all. It was bad enough prior to the diagnosis. Now it's shocking. But this is where the NDIS services help. And this is where making our home better for, I want John at home forever.
Have you thought about what might happen if you're no longer able to care for Jonathan at home?
Yeah, I have. So I've already said to myself that if safety is an issue, then that's it. Like I call it. Jonathan would never want to be in a position where he's harmful to himself or to me or to our family. So for me, that's the deciding factor.
Luke, after caring for Lisa at home, you placed her in specialised care. How have others reacted to that?
It's been very divisive. So I found it very difficult to get people to believe me about the things that were happening either at the home or in the hospital or in the aged care facility, because they just weren't willing to either visit and spend the time to get past the first sort of 10 or 15 minutes at those times where, Lisa might present as quite normal, and then she was, but it wouldn't be until you spent more time with her that you could see that the things that I was trying to tell them were true. So, through the journey, I've lost contact with friends and particular family members who didn't agree with the way that I was going about it and the decisions that I was making for Lisa's care.
Your 3 kids are in their teens. How has Lisa's illness affected them?
It's been a real journey. I made a decision early on to take the kids through that journey with me and with their mum. People weren't always supportive of that, but I had particular family members and friends say, no, they shouldn't see their mum. And to be honest, at times I'm sure that Lisa wouldn't have wanted the kids to see her the way that she was. But having been through that journey, they're amazing humans. They're still young, but they're compassionate and empathetic and understanding, and I'm super proud of them.
Good job parenting as well, Luke. Jasmine, you still care for your mum in her home. You receive home care support through the My Aged Care scheme. What does that look like?
That's about 6 hours a week, so 2 hours per day for 3 days of somebody coming in and just giving me a break. So 2 hours maybe to do laundry for mum or maybe fix her a meal. And it's really helpful. And sometimes I actually stay on and chat with them. So we've become very close. I think if I didn't have that support, I would... I don't know how I would cope.
Really?
Yeah.
What do those hours a week mean to you?
It just means I can go out for a coffee and have peace of mind.
Do you think you'd be able to care for your mum the way you do now if you had kids?
I think it would be a big challenge. I do have a nephew that I look after. It's managing, but it's great because there's this intergenerational support and everybody chips in, even though we're all kicking and screaming, but we're all chipping in while kicking and screaming.
You seem like a very positive person, Jasmine. How do you stay positive as a carer?
I have this lady, this wonderful lady who gave birth to me and reminds me every year on my birthday that I was such a painful birth.
Really? When you project forward and think about a life without your mum in it, how does that make you feel?
I can't imagine it. Ma, what's going to happen if you go away and you die? What's going to happen to me?
That is why I advised her to quickly say yes to a man.
You have to quickly say yes to a man. There you have it, right out of your mum's mouth, Jasmine.
This is the etching for Moi, my wife. Moi is shown here as a lighthouse, something that's really strong and very able to handle anything nature will fling at it, including me. My name's Leon Pericles and I'm based between Margaret River and Perth in Western Australia. My career in the last 50 years has been attached to producing art through a huge range of topics and mediums. Moi was a real confidant. I relied on her as a major bouncing board. Moy was in her late 50s when she was diagnosed. I'm wealthy enough to be not a pensioner, so it's costing me $52,000 a year to keep her alive. So I'm working harder than any other artist my age, especially in WA, to keep those funds going. I drive to Perth once every week. It's a big drive. Yoda keeps me company. Come and see Moy. Hello, darling. Hi, honey. Yoda's here to see you. Yoda's here to see you. Yes, he's so excited. He's come to say hello. She really loved her classical music. Moy and I used to be able to sit together at a concert and we'd hold hands through it. And we'd squeeze our hands and say, wasn't that wonderful? And we'd both be in the same element. That hasn't happened for ages. Yeah. Moy made it quite clear that she didn't want to be here when she had her mother's disease. She dropped a letter on my desk and it said, if I get my mother's disease, then the moment I no longer recognise anybody, I want to be euthanised. And you then realise the suffering that she's already under to write something like that. I realised that she wasn't recognising the family. I've always thought, what would I do?
Nia, Leon and Moira are your parents.
Yeah.
What was your mum like before dementia?
Well, she's still very cuddly and adorable and very tactile, but it's weird talking about her in the past tense, right? But before dementia, she was incredibly vivacious and loving and had a ripping sense of humour and incredibly smart, voracious reader, and but she was a very savvy businesswoman, so she helped. She ran the business, the art business for Dad, and a lot of artists kind of speak about Mum as someone that they wish they had in their life to kind of enable that success. So, yeah, she was amazing.
Your mum wanted to be euthanised. Did she do anything else to have her wishes heard?
Yeah, I mean, she made it really clear to all of us, to the family. Mum and Dad wrote a letter where she declared that if she was not able to recognise the family, that she would want to be euthanised. And in the early stages, in her 60s, as she declined, I was making a documentary film about Mum and Dad, and she was so playful in that phase, but she was also acutely anxious, and she would... Actually, it was a running joke in the family with her that we would kind of talk about how she wanted to end her life. So she'd sort of say, oh, maybe push me off a cliff, or, you know, I'll run in front of a truck. And then she'd say, no, that's too messy. We won't do that. But underlying that was a deep, acute anxiety, having seen her own mother decline. She was living her number one fear. And it scared everybody because at one point she did try to end her life, and Dad caught her.
If voluntary assisted dying, or VAD, was available to dementia patients, would you want that for your mum?
Yeah, hands down, absolutely. We would be, you know, I think it would be incredibly difficult, and I don't know how Dad would go with it, but certainly my brother and I, we've all talked about it. We would love to honour her wishes.
How do you feel not being able to honour those wishes?
Oh, yeah, so guilty. I think, you know, hearing that word guilt, and yeah, it's terrible. You're completely powerless. The home rang me the other day asking, would you like to give Moira a COVID vaccination? And you think, that's my only option, to say no to that, because there's a chance that maybe she'll get COVID and die or something, you know, like we're just powerless. You know, it's ridiculous that I'm in that position, my family, and that so many Australians are forced into that position where they want to act on their own, and there's nothing that we can do legally.
Henry, Australia's VAD laws currently do not include dementia. Is there a push to have it included?
Certainly, there are people who've been writing about this and asking for it. People have to be competent to give the okay to have voluntary assisted death. And the time you want to have voluntary assisted death with your dementia is when you're incompetent. So should you be able to do it in advance? It's complicated because if we allow people to give advance directives for VAD, but they're not sure if they want to do it later on, and the family says, well, they've said that beforehand, we have to be sure that the motives of the family are for the person's benefit, not for their own benefit, say financially. So I can understand the legal safeguards.
Can you have conversations about advanced care directives early on?
Absolutely. I've done it for myself. So people should think about these things in advance and think about contingencies. But if I'm in a vegetative state and have no quality of life, I don't want my pneumonia to be treated. I don't want my COVID to be prevented. I would rather go.
Jessica, your mum died of dementia. It runs in your family. Did the experience of caring for your mum change how you view your own life?
Yeah, it did. I don't think I've realised that it has, but subconsciously I've definitely sort of changed the way I approach life in subtle ways. I'm far more conscious of sleep, of how much sleep I get. I'm far more conscious of eating well and exercise, but everything in moderation. I don't limit myself either, because I think having fun is very important. I don't have kids. I've spent a lot of my life looking after my mum and also striving for a career. But I think it's always been in the back of my mind that I don't ever want a younger version of me to go through what I went through if I was to ever get it. And I wouldn't want to put that burden on. But I also don't want that to stop me from having kids. So it's a...
Sounds like a tough balance.
It is, yeah.
Jacob, you've been reporting on aged care for over a decade. What do you think needs to happen to have better care for dementia patients?
We need a complete rebuild, like the aged care system. It's just in its current form, it's warehousing people. You can look across the globe, like some of the Scandinavian countries and places like that, these small living facilities and more community integration, these sort of things have a profound effect on people's happiness. And a couple of the major things out of the Royal Commission was, how do we fund it? And they recommended a levy.
So basically paying money at around 40 or something into your own aged care so that you could access it later on.
Exactly, paying for your own care, but it kicks in when you're a little bit older and more established, so you're not taking money off, young people who are just sort of getting into the workforce. But, you take it a step back even further, it's like, how valued are old people currently? I mean, they're not.
David, are you on board with this idea of a levy?
In 1992, we introduced superannuation. This year, we spent $62 billion on the age pension. If we didn't have superannuation, we would have spent $160 billion on the age pension this year. Okay, superannuation saved $100 billion from the federal government expenditure. That's what a levy could do. That's what we recommended in the Royal Commission, is that we should introduce a long-term care insurance type product. It's the only way to solve the problem, because what it does is it moves the burden of financing the aged care of each generation onto that generation itself, which is the right size to solve the problem.
Jasmine, you gave up a life and career overseas to care for your mum. What has your mum's dementia taught you?
Mum's actually taught me to have resilience and also to be thankful, because I wouldn't want to have it any other way. And she worked really hard, 3 jobs when she was younger. So now it's my time to give back. And I also thank the system, because the system has kind of worked to support us. And without that, even though we waited for a very long time for her to get on aged care, my dream is to work at SBS.
Halfway there.
Oh, well. But just sitting here next to Mom it's been exciting. It's like a trip to, to do something, and I'm doing things with her, and I've asked her, would you like to be in a caravan with me, or should we go on a cruise? So she said, is it caravan or cruise? Cruise.
Cruise.
We want to do things together, and I think how I've embraced it is just including Mum. A lot of people that I do freelance work with, they know that I have a mum with dementia, because sometimes I might not be able to respond instantly. So I think getting people around you, and getting that community support is really, really important. Yeah, I think there's no other way. I don't know. This is just the only way that I know.
Thank you so much, and thank you to you all for being here, for having such a tough conversation, but I so appreciate your honesty. Thank you, and thank you for your company. I'll see you next time.